Hello and welcome to the review part 2 for experimental design. Experiments and inference. Does regular exercise cause your heart rate to go down? Will taking a special preparatory course raise your SAT scores? Does smoking cause lung cancer? The goal of every experiment is to establish cause by comparing two or more conditions, the treatments, using an outcome variable, the response variable. Confounding. For comparative studies, a threat called confounding can lead to false conclusions. Confounding or confounded means mixed up, confused, at a dead end. The lurking variable. Children who drink more milk have bigger feet than children who drink less milk. There are three possible explanations for this association. The first one is drinking more milk causes children's feet to be bigger. And the second one is having bigger feet causes children to drink more milk. And the third one is that there's a lurking variable that's responsible for both. The lurking variable, one that lies in the background and may or may not be apparent at the onset, but once identified, could explain the pattern between the variables. Factors and levels. A factor of an experiment is a controlled independent variable, a variable whose levels are set by the experimenter. A factor is a general type or category of treatments. Different treatments constitute different levels of a factor. For example, 3 different groups of runners are subjected to different training methods. The runners are the experimental units, the training methods, the treatments, and where the 3 types of training methods constitute 3 levels of the factor or the type of training. Why randomization makes inference possible. If you assign treatments to units at random, then there are only 2 possible causes for a difference in the response to the treatments, either chance or the treatments. If the probability is small that chance alone will give you such a difference in the responses, then you can infer that the cause of the difference was the treatment. The placebo effect. A placebo is a fake treatment, something that looks like a treatment to the patient but actually contains no medicine. When people believe they are receiving special treatment, they tend to do better. This is called the placebo effect. How can scientists determine if a new medication is effective or whether the improvement is due to the placebo effect? Well, they use a group of subjects who provide a standard for comparison. The group used for comparison is usually called the control group if the subjects receive a placebo, and it's called a comparison group if the subjects receive a standard treatment. Blind or double-blind. In order for the control or comparison group and the treatment group to be exactly alike, both the subjects and their doctor should be blind. That is, the patients should not know which treatment they are receiving, and the doctors who evaluate should not know what treatments the patients received. Now, it's called a blind only if the patients are blind, and it's a double blind if its patient and doctor are blind. Randomized comparative experiment. A good experiment must have both the random assignment of treatments to units and a control group or comparison group that is compared to the group getting the treatment of interest. That will conclude the part 2 of the review for experimental design.